Hi, I'm Olivia Solon and I am editor of Tech Investigations at NBC News. As my job title suggests, I usually cover stories relating to technology. However, this week I published a story about couples who have had their IVF cycles cancelled. The article was called "Adding Insult to Injury, Couples Struggle with IVF Cancellations Amid the Coronavirus Pandemic." And there's a link to the story below this video. Now, this is a story that's close to my heart because I myself went through IVF back in 2018, and I'm still on the clinic's mailing list. But a couple of weeks ago, the clinic I use sent me an email explaining that they'd had to cancel a bunch of people's treatments. Now, dealing with infertility and going through IVF is already an incredibly stressful, time-sensitive and expensive process. So when I saw that email, I just couldn't imagine how difficult it would be for people who were going through this process and were already halfway through. So I set out to find out what it was like for them. And I contacted a bunch of women, their partners, clinics and mental health providers to find out. Now, most of the clinics are following guidelines from the American Society of Reproductive Medicine, which recommended stopping all new cycles. So that means that people shouldn't be starting rounds of injections to stimulate their bodies to produce more eggs, which are then later removed by surgery. And after that part of the process, those eggs are turned into embryos, they're fertilized in a lab, they're grown for a few days, and then they're transferred back into a woman's uterus. And so those are the two kind of key stages of IVF. In some very rare cases, and I spoke to one woman for whom this happened, clinics just closed overnight. And this leaves patients in the worst possible situation where you're halfway through the injection phase. One of the women I spoke to, she'd been injecting herself morning and evening. Well, actually, her husband had been injecting herself because she hated injections so much for 5 days when her clinic called and said she had to stop. And so this means that not only had she wasted $3,000 in medication, but she wasn't going to be able to go through with the procedure to harvest her eggs, which is like a small operation. And this is like the most invasive part of the IVF process. And because she'd done all these injections, she was left in a state where her ovaries were really swollen. And this is because they're producing more eggs than usual. And this is a process you have to monitor really carefully normally. So she wanted an ultrasound to check on the state of her ovaries, to see if she had developed any ovarian cysts, which can sometimes happen, but they wouldn't even let her do that. Most of the people I spoke to weren't in this situation. They were either had all their medication ready to go in the fridge and were told they couldn't yet do that, or they had done that part of the process and then they were waiting to have an embryo transferred to see if it would take and result in a pregnancy. Now, and many of these women had just been trying for so many years through using all different techniques, including multiple rounds of IVF in many cases. They'd had a lot of heartbreak, and some of them feel like time is just running out. So I just wanted to answer any of the questions that you have on this topic. And I'm happy to take any questions. If there aren't any questions, I can talk a little bit about some of the story. I spoke to about 10 different women and some of their partners, and some of them had literally just got all their medication ready to go in the refrigerator. One of the women I talked to, she was only 26, but she'd had many. Oh, hang on, there's a question. I'm going to answer that. Are clinics allowing patients at a certain stage in their treatment to continue? So yes, some clinics are saying that most clinics should be doing this thing where if they've already started the cycle of IVF, as in they started to do the injections, as one of the women in my story had done, that they should be allowed to complete that because it's so invasive already. And so the general guidance is that people under those conditions should be allowed to continue with their treatment. However, in some cases, clinics are just closing overnight, and we're not sure whether that's because they've had a case of COVID-19, or they suspect there's a case of COVID-19, or their doctors and nurses don't want to expose themselves to that risk. But yes, they should be allowing patients at a certain stage of their treatment to continue. There is a lot of push now. There's been a massive petition that was signed by I think it was about 10,000 people last time I checked, to allow for more flexibility, allow clinics that aren't affiliated with hospitals where there's a higher risk of transmitting COVID-19 to decide on their own whether they want to proceed with certain procedures or not, maybe focusing on women who are in their 40s, who possibly have less time, and every month counts. And so that's certainly something that's up for debate at the moment in the fertility or infertility community, and it's something that many of the patients are absolutely desperate to push for. So the next question is, could women transfer to other clinics or doctors' offices that have not closed? Yes, that's a possibility. I think, or at least that was a possibility. I think now that the guidelines have been released by the American Society of Reproductive Medicine, I'm pretty sure all clinics have fallen in line with those guidelines, which is that they can't they can't start any new rounds of IVF. However, as I just mentioned, there's a lot of pressure to change that and to allow there to be more discretion, particularly at clinics that aren't attached to a hospital, clinics that feel as though they can take measures of social distancing, take extra precautions, and they can keep patients as safe as possible. For a lot of the people I spoke to felt like now is almost a good time to do this procedure. They're at home anyway. They're being extra careful. They're not going out. They're not likely to expose themselves to diseases. Obviously, there is a pandemic, so that's like a big, big but. So they feel as though this could be, provided their clinics were comfortable with it, could be actually a good time to do it. And clinics certainly are taking extra precautions for those couples who are still finishing a cycle that had already started by the time these rules were made. I spoke to one couple who the clinic doesn't let them come into the waiting room. They have to wait in their car outside the clinic, and as soon as their room is ready for the appointment, only the woman is allowed in. Her partner, her husband, was not allowed into the room. And she would go up, she would have her temperature checked at the door, she would the nurses and all the staff would be wearing masks, and she'd have to hand sanitize. They would obviously be doing that anyway. And they'd even put gloves on to handle her credit card when she was paying. And so yeah, clinics are already used to preventing the spread of infection. And so I think some of them are more pushing a little bit more to be able to continue practicing. Another question is, how much money do these procedures cost? Are couples losing all the money they have paid? So IVF is incredibly expensive. I know this firsthand. It can cost, it depends on where you are in the country, but I think it can cost anywhere from around $10,000 all the way up to $30,000 for a cycle. And that includes all of the different stages. So that starts with the injection stage, the harvesting of the eggs, which is a small operation. Then there's like the fertilization of the eggs, and then there's the transfer of the embryos, hopefully into the woman. And so if you were in the situation that the woman who's already in the round of injections was in, you would have lost any of the cost of the drugs that you'd already injected yourself with. And she was told she wasn't going to get a refund. She said she lost $3,000 worth of medication from injecting herself and then not being able to go through with the procedure to take the eggs out and then transfer the embryos. For other people, again, it depends on what phase. One couple who I hope had they did have their egg retrieval yesterday. They were due to have it yesterday. It could have been cancelled at any moment, but I believe it went ahead. But if that had been cancelled at any point, they would have lost lost all their money. As far as I can tell, none of the clinics have said they were going to give any refunds at all. So it's a huge hit emotionally and financially. Another question is IVF ever covered by insurance? Yes, it's not typical. But a lot of companies, I know that a lot of companies, particularly where I am in California, the big technology companies that are trying to be very competitive, do offer IVF or infertility coverage as a benefit. It depends on, I've heard that Facebook, for example, offers people up to $100,000 worth of IVF treatment, or 4 rounds, I think, of IVF, which is incredibly generous. And but I don't think that's the norm by any stretch of the imagination. So the next question is, could starting treatment and stopping midway be harmful for patients? Yes, again, depending on which stage of the process you are at. A lot of people have to have certain minor surgeries before they have an embryo transferred into their uterus. And so for some of those patients, if they don't have the transfer within a certain window of time, they might have to have that procedure again. And obviously, anytime you have to have a minor operation, that comes with risks. And then there's the situation that I described at the beginning of the person whose cycle was cancelled halfway through the injection phase, which is the most invasive and, well, at least in my experience, was the most brutal part of the process. And if you start, you're injecting yourself to stimulate your ovaries to produce more eggs. And so your ovaries are unnaturally swollen, and they're sort of overperforming to try and deliver more eggs. And so that, you feel very swollen, you're in a lot of pain, you can get cysts, which should subside on their own, but generally it is a risky process and it needs to be monitored really carefully. Most of these patients should be having ultrasound scans and blood tests like every other day almost. So yes, it can be harmful for patients, but I think most of the clinics did continue made sure that patients could finish those cycles, that part of the cycle, and then they took a break between the injection stage and then the transfer stage. But it's still incredibly harmful emotionally. Every month counts when you're in this situation. You'll feel like this real ticking clock sensation, particularly for the patients in their early to mid 40s, where it really does, every month really does count. One more question is, for women who've had to stop treatments, do they have to start over when things go back to normal? If you were in the injection stage and you weren't able to get to the point where you're retrieving the eggs, yes, they'd have to start things over. And so, I think that's incredibly demoralizing. You've already started this process, like the injections, if you're not used to injecting yourself, many people are scared of needles. It's a real process. You get bruises all around your stomach, you feel very swollen, and then to have to stop that part of the process and then start it all over again. And there's like a bunch of stuff you have to do before you even get to the injection stage as well, just to prepare your body for it. I just think it's a big setback. But, hopefully things will get back going pretty soon, and people will be able to resume their treatment. Are clinics expected to reopen once quarantine measures are lifted? At the moment, I think that is the case. Yes. At least I spoke to a clinic here in California, and they were waiting for the shelter-in-place order to be lifted, and then they wanted to start resuming some of their treatments for their high, I don't want to say high-risk patients, but high-priority patients in terms of either they are a little older, so time, extremely time-sensitive treatment, or just other patients who had like maybe they'd had a minor surgery to prepare their womb to receive an embryo. They would focus on those patients. But it's still waiting. We don't even know when the quarantine measures are going to be lifted. And then they still need to wait for the American Society of Reproductive Medicine to make a determination on what people should be doing. So it's very unclear at the moment, unfortunately, and so it's just leaving a bunch of people in this sort of horrible limbo. And I just feel huge amounts of empathy for those people, and I hope that they are seeking the mental health support that they need. There are lots of services available to them, and so I think that's definitely something for people to consider. But that's going to be the last question I answer about this. I am available on Twitter if you want to ask more questions. I'm at Olivia Solon, or you can, post comments below this video when it's posted. But otherwise, thank you very much, and stay safe.